If you're a woman, this is really important information, and if you're a man with a partner going through menopause, this is something you need to know as well. Most mainstream doctors say menopause happens because estrogen drops, and the standard treatment is hormone replacement therapy. On the surface, that seems simple. Your hormone drops, you replace it, problem solved. But the reality is more complicated. Hormone replacement therapy comes with risks: breast cancer, endometrial cancer, blood clots, higher risk of stroke, gallstones, fluid retention, and elevated triglycerides that can increase cardiovascular risk. And that's just from the hormones themselves. Most women also end up on a whole range of other medications: drugs for hot flashes, medications to manage weight, rise for mood, NSAIDs for joint pain, treatments for bone and muscle loss, and medications for high blood pressure. This phenomenon is called polypharmacy. Many drugs prescribed because of one common misunderstanding about menopause. The truth is, all these symptoms, hot flashes, weight gain, mood swings, bone loss, muscle loss, often come from one root cause. Not separate issues, but a single underlying mechanism, which we'll get into. Menopause generally occurs around age 52, though some women experience it earlier or later. At this stage, the ovaries essentially retire and stop releasing eggs. This leads to a sharp drop in several hormones, not just estrogen. Estrogen can fall dramatically, sometimes from 400 down to 20. Testosterone also decreases, and progesterone can drop close to zero, though this is less often discussed. When estrogen drops, it sends signals to a part of the brain called the hypothalamus, which functions like a master control center or microcomputer. Within the hypothalamus is a kind of thermostat regulating core temperature. When estrogen declines, this thermostat gets disrupted, which explains symptoms like hot flashes, night sweats, and other changes associated with menopause. Your hypothalamus is constantly monitoring your core temperature, which should stay around 98.6 degrees. If it starts drifting too high or too low, your body automatically adjusts. It might generate heat, trigger a hot flash or night sweat, or even make you shiver to produce more warmth. Think of it like a thermostat in your home. Normally, there's a buffer zone. It can fluctuate a little before it actually triggers a response. But after menopause, when estrogen drops, that buffer zone shrinks significantly. Even minor variations in temperature can set off a cascade of reactions, causing hot flashes and other symptoms. And temperature isn't the only trigger. Blood sugar changes, stress, and other factors can trip this thermostat too. But the hypothalamus does more than just control temperature. It also regulates your set point, the weight your body naturally gravitates toward. This is why losing weight during menopause can feel impossible. You diet, you exercise, you lose a few pounds, and then your body hits that set point and resists going lower. It also controls appetite, how often you feel hungry, what you crave, and even your overall body weight. That's why many women notice weight gain during menopause, and metabolism isn't just about calories. The hypothalamus regulates energy production, insulin sensitivity, and is highly sensitive to light, which connects it to circadian rhythms. All of these changes together explain why menopause can cause hot flashes, midsection weight gain, mood changes, inflammation, low libido, bone loss, muscle loss, high blood pressure, and an increased risk of diabetes or heart disease. The underlying cause of many of these symptoms is the altered function of this small but powerful part of the brain. Another important factor, insulin resistance. When the hypothalamus is affected, insulin sensitivity drops, which can lead to pre-diabetes or type 2 diabetes. This isn't just a coincidence. Insulin resistance is tightly linked to many menopausal symptoms, including weight gain and energy loss. Here's something really interesting I found when looking at different populations. Women going through menopause aren't all affected the same way. African American women, for example, experience hot flashes at an astonishing rate, between 80 and 91%. That's far higher than in most other populations, and it gives us a clue about what's really going on. One major factor is vitamin D. People who are deficient in vitamin D are much more likely to experience hot flashes, and skin color plays a role here. Melanin, the pigment in darker skin, acts like a natural sunblock. The more melanin you have, the less UV light penetrates your skin to produce vitamin D naturally. In America, this creates a direct link between skin color, vitamin D levels, and the frequency of hot flashes. Now let's connect this to estrogen. During menopause, estrogen drops significantly, but estrogen isn't just important for reproduction. It also protects beta cells in the pancreas. Beta cells are responsible for producing insulin and regulating blood sugar. When beta cells are damaged or insulin sensitivity drops, diabetes can develop. Estrogen helps keep cells insulin sensitive, and insulin resistance is a root cause behind so many chronic diseases: type 2 diabetes, obesity, fatty liver, high triglycerides, and more. So when estrogen drops, insulin sensitivity declines, blood sugar fluctuates, weight increases, and the whole system becomes stressed. Estrogen also plays a major role in controlling inflammation, and inflammation is one of the key reasons why the hypothalamus thermostat becomes more sensitive. A narrower thermostat zone means even minor changes in temperature, blood sugar, or stress can trigger hot flashes and other menopausal symptoms. So what we see is a cascade: low estrogen, increased inflammation, insulin resistance, and vitamin D deficiency, all contributing to hot flashes, weight gain, and the wide range of symptoms women experience during menopause. Now, let's talk about another critical piece: your liver and how it manages blood sugar. Estrogen helps regulate the amount of sugar your liver produces. In someone with diabetes, the liver becomes insulin resistant. That means insulin can't effectively signal the liver to store sugar, so the liver interprets this as a shortage of sugar. In response, it starts producing sugar nonstop, a process called gluconeogenesis, or the creation of new sugar by the liver. In fact, even in diabetics, up to 80% of blood sugar comes from the liver, not from the food they eat. Estrogen plays a major role in keeping this process balanced. When estrogen drops during menopause, blood sugar control weakens, insulin resistance rises, and this contributes to visceral fat, midsection weight gain, and the stubborn weight set point we talked about earlier. To lose weight effectively after menopause, addressing insulin resistance is crucial. Now let's tie this back to vitamin D, which plays a surprisingly important role in this system. Estrogen has a significant influence on vitamin D activation. Vitamin D in your blood starts off inactive and must be converted in the kidneys to its active form. Estrogen is essential for that conversion. Even after vitamin D is activated, it still needs enough estrogen to bind properly to receptors in your cells. Without estrogen, vitamin D cannot fully do its job. That's huge because vitamin D supports almost everything we've discussed: blood sugar regulation, inflammation control, metabolism, and even energy production. There's also an enzyme in your adrenal glands and fat cells that converts testosterone into estrogen. Since your ovaries aren't producing estrogen anymore, you rely on this pathway, but it only works efficiently if you have enough vitamin D. This creates a double-edged sword. Low estrogen reduces vitamin D effectiveness, and low vitamin D reduces your ability to produce estrogen. Both are essential for balancing metabolism, insulin, and overall energy. And one last point here: if you're vitamin D deficient, your temperature regulation can get worse. The parathyroid hormone, which is closely connected to your thyroid, acts as a backup for vitamin D. When vitamin D is low, parathyroid hormone levels rise to compensate, but it's not a perfect solution. Another major consequence of low vitamin D and estrogen after menopause is bone loss. When vitamin D is insufficient, the parathyroid hormone rises to compensate. This hormone starts mobilizing calcium from your bones, which is why many women experience rapid osteopenia or even osteoporosis shortly after menopause. In my practice, I saw women who suddenly developed bone density issues within weeks. This isn't uncommon, and it all comes back to that hormonal imbalance. The good news is that this can be mitigated if you maintain sufficient vitamin D levels. The problem is, most doctors are working from outdated guidelines, which suggest we only need 600 to 800 IU of vitamin D3 per day. That is far from enough. Vitamin D plays a role in immune system function, estrogen support, muscle health, bone health, and more. To truly maintain these systems, you need between 6,000 and 10,000 IU daily, and that's just for maintenance. Therapeutic dosing for inflammation or autoimmune conditions can be even higher. Here's the danger. If you think having a blood level of 20 nanograms per milliliter is normal, you're not actually getting enough vitamin D to support all these processes, and with estrogen levels already low, your body struggles even more to utilize vitamin D. That's when parathyroid hormone spikes, pulling calcium from your bones and accelerating bone loss. So, you see the problem. This is why it's critical to approach menopause with an open mind. You have to consider lifestyle, diet, vitamin D, insulin sensitivity, and not just rely on medications to treat symptoms. Now, what can be done? The most important step for managing menopausal symptoms is addressing insulin resistance. Increasing estrogen through hormone therapy is an option, but the side effects can be significant. Instead, improving insulin sensitivity often alleviates many menopausal symptoms naturally. Remember, it's normal for estrogen to dip during menopause. The goal isn't to push it unnaturally high, but to support your body so symptoms don't appear. Fixing insulin resistance can be achieved with diet. Key strategies include reducing carbohydrates, practicing intermittent fasting, and incorporating targeted nutrition. With the right approach, insulin resistance can be reversed relatively quickly. The second key factor is vitamin D3. While 10,000 IU daily is often recommended, I would actually suggest 20,000 IU per day in certain situations. You might think that's a lot, but it's roughly equivalent to 40 minutes of sun exposure. Given all the barriers, low estrogen, limited sun exposure, skin pigmentation, and age-related factors, this higher dose is sometimes necessary to get vitamin D to levels that actually support estrogen function and overall health. Vitamin D isn't just important for bone and hormone health. It also has a major impact on insulin resistance. Supporting vitamin D levels can help improve blood sugar control and reduce many symptoms associated with menopause. Along with vitamin D, I highly recommend magnesium and vitamin K2. Magnesium does a lot. It can reduce cortisol, improve sleep quality, and support multiple aspects of menopause that often get overlooked. While vitamin D is the most critical piece, combining it with magnesium and vitamin K2 to support bone health creates a powerful foundation for overall wellness. While addressing the root causes like insulin resistance and low vitamin D is essential, many women still want symptom relief right away. The challenge is that many medications for menopausal symptoms come with side effects. Fortunately, there are drug mimickers, compounds or natural options that can help reduce symptoms without the risks. One option is NK3R agonists, drugs designed for certain menopausal symptoms. But there are also natural alternatives, soy isoflavones. Though I usually avoid soy, a small amount can help in certain cases. Resveratrol has shown potential benefits. Black cohosh, popular for hot flashes and other symptoms. Red clover, another supportive herb. Another key factor is light exposure and circadian rhythm. Remember, the hypothalamus, the brain region controlling your thermostat, is highly sensitive to light. Aligning yourself with natural light and dark cycles can dramatically improve symptoms. In the morning, get at least 20 minutes of sunlight. If that's not possible, use a full spectrum therapeutic light for about 30 minutes, preferably while at your computer. At night, reduce blue light exposure from screens. Use blue light blockers, dim your lights, and simulate darkness to help reset your hypothalamus. For some women, progesterone cream can also help. Progesterone often drops even more than estrogen during menopause, so the ratio between these hormones is important. Supporting progesterone can improve sleep and balance. Finally, some women benefit from melatonin for sleep regulation, especially when hormone shifts make it difficult to rest. Normally, I don't recommend melatonin as a first-line approach, but if you've tried all the other strategies and still struggle with sleep, getting to bed at the right time and supporting deep sleep is absolutely critical. Compared to pharmaceutical drugs, melatonin, taken at around 3 milligrams, has virtually no side effects and can be extremely helpful for restoring healthy sleep patterns. After menopause, some biomarkers spike dramatically, especially luteinizing hormone LH. In some cases, LH can increase by over 1,000%, which can worsen hot flashes and make menopause feel miserable. Interestingly, melatonin can help modulate this hormone, and here's a fascinating natural insight. Exposure to sunlight can also increase melatonin. Over 50% of sunlight's rays are infrared, which triggers melatonin in production inside your cells, giving you another way to support healthy sleep and hormone balance. Another factor to consider is testosterone. For some women who have tried everything else and still struggle with symptoms, testing testosterone with a competent physician may be useful, particularly if considering testosterone pellets. Environmental factors like the abundance of plastics have caused testosterone levels in both men and women to drop significantly. Be careful with normal ranges reported in labs. They often compare your levels to the general population today, not to optimal levels from 20 or 30 years ago. Testosterone is also important because it's a precursor hormone. It can convert into estrogen. Supporting testosterone in this way can improve insulin sensitivity, enhance vitamin D activation at the receptor level, and help reduce many inflammation-driven menopausal symptoms. Ultimately, the most important step is still addressing insulin resistance because that underlies so many of the changes seen during menopause. Supporting insulin sensitivity will improve hormone balance, reduce inflammation, and make all the other strategies, vitamin D, magnesium, circadian alignment, and natural hormone support, much more effective. For those who want a deeper dive, I've included a link to a video that explains exactly how to fix insulin resistance and tackle these root causes.